Welcome to Lesson 18 to 2026 Home or Residency M Services. In this lesson, we'll learn how to code home and residency M visits, including new versus established patients, MDM versus total time, CPT 99341 through 99350, and important 2026 Medicare updates. We'll also cover G2211, prolonged services with G2311, common coding traps, CPC scenarios, and practice MCQs. Let's begin and build a strong CPC-ready understanding of home or residency M services. Before we begin, let's review the objectives for this lesson. We'll learn home or residency M services, understand home and residence settings, distinguish new versus established patients, and review CPT 99341 through 99350. We'll also learn how to select the appropriate level using MDM or total time, review the 2026 G2211 update and G2311 prolonged services, and practice CPC scenarios and MCQs. Remember, this lesson is for educational and CPC exam preparation purposes only. Always verify the most current CPT, CMS, Medicare, and payer-specific guidelines before applying coding information professionally. For the CPC exam, remember, setting right pointing arrow patient status, right pointing arrow service, right pointing arrow MDM or time, right pointing arrow documentation, right pointing arrow payer rules. Home or residency M services are evaluation and management services provided to patients in their home or qualifying residential setting, instead of a traditional office. These services may include the patient's home, assisted living, group home, custodial care, and certain residential treatment settings. The current home or residency M code family is 99341 through 99350. For CPC questions, remember to identify the place of service first, then determine the patient status and appropriate M level based on MDM or total time, as applicable. And remember, home or residency M is not the same as home health care. Think: setting right pointing arrow patient status, right pointing arrow M level, right pointing arrow MDM or time. Now let's identify the place of service, because this is an important CPC step. POS 12 is the patient's home. POS 13 is an assisted living facility, and POS 14 is a group home. POS 33 represents a custodial care facility, while POS 55 represents a residential substance abuse treatment facility. For the CPC exam, remember, 12 home, 13 assisted living, 14 group home, 33 custodial care, and 55 residential treatment. Always identify the place of service first before selecting the appropriate M code. Now let's understand the difference between a new patient and an established patient. A new patient has not received a qualifying professional service from the physician or another physician or QHP of the same specialty and subspecialty within the same group practice during the previous 3 years. An established patient has received a qualifying service within that 3-year period. For the CPC exam, don't simply ask whether the patient saw the same physician. Remember the key factors: 3 years, same group practice, and same specialty or subspecialty. Your memory trick is simple: no qualifying service in 3 years, right pointing arrow NEW. Qualifying service within 3 years, right pointing arrow ESTABLISHED. Let's use a simple 3-step process to determine new versus established patient. First, check the patient's professional service history for the previous 3 years. Second, identify whether the service was provided by the same physician or another physician or QHP within the same group practice. Third, check the applicable specialty and subspecialty relationship. If there is no qualifying service within the previous 3 years, the patient is new. If there is a qualifying service within that period, the patient is established. For the CPC exam, remember, 3 years, right pointing arrow group, right pointing arrow specialty, right pointing arrow patient status. And don't assume a patient is new just because they are seeing a different physician. Now let's review initial home or residency M services for new patients. The current code family includes 99341, 99342, 99344, and 99345. 99341 represents straightforward MDM, 99342 represents low MDM, 99,344 represents moderate MDM, and 99,345 represents high MDM. Remember, 99,343 is not a current 2026 code. The level may be selected using MDM or total time, when permitted by the applicable CAPTAIN guidelines. For 2026 Medicare, G2211 may also be reported with qualifying home or residency (M) services when the requirements are met. For the CPC exam, remember, 99,341 right pointing arrow straightforward, 99,342 right pointing arrow low, 99,344 right pointing arrow moderate, 99,345 right pointing arrow high. Now let's review home or residency (M) services for established patients. The current code family includes 99,347, 99,348, 99,349, and 99,350. 99,347 represents straightforward MDM, 99,348 low, 99,349 moderate, and 99,350 high. The level may be selected using MDM or total time, when permitted by the applicable CAPTAIN guidelines. For 2026, Medicare also allows G2211 with these qualifying home or residency (M) codes when the applicable requirements are met. For the CPC exam, remember, 99,347 right pointing arrow straightforward, 99,348 right pointing arrow low, 99,349 right pointing arrow moderate, 99,350 right pointing arrow high. Easy memory trick. Asterisk 47484950 equals straightforward low moderate high. Home or residency (M) services can generally be selected using medical decision-making, or MDM, or total practitioner time, when permitted by the applicable CAPTAIN guidelines. For MDM, consider three elements: problems addressed, data reviewed and analyzed, and risk of patient management. When selecting by time, use the applicable total practitioner time for the encounter, following CAPTAIN guidelines. For the CPC exam, remember, MDM equals what was medically managed. Time equals how much qualifying time was spent. Always make sure the documentation supports the selected level and the service is medically necessary. Here's an important 2026 Medicare update for home or residency (M) services. Beginning January 1, 2026, Medicare allows HCPC G2211 as an add-on code with qualifying home or residency (M) services. The qualifying codes include 99341, 99,342, 99,344, 99,345 for new patients, and 99,347, 99,348, 99,349, and 99,350 for established patients. Remember, G2211 is an add-on code, not a replacement for the primary (M) code. For the CPC exam, remember, 2026 right pointing arrow home, residency (M) plus G2211, when all applicable Medicare requirements are satisfied. Always verify the current CMS guidance and documentation requirements before reporting G2211. Now let's review G2311, the Medicare add-on code for prolonged home or residency (M) services. G2311 is reported with 99,345 for a new patient or 99,350 for an established patient, when the primary (M) level is selected based on time and the applicable prolonged service threshold is reached. The Medicare threshold is 140 minutes for 99,345 and 110 minutes for 99,350. G2311 is reported for each additional 15 minutes of qualifying prolonged service beyond the applicable threshold. For the CPC exam, remember, 99,345 right pointing arrow 140 minutes. 99,350 right pointing arrow 110 minutes. Home, residence right pointing arrow time right pointing arrow G2311. And remember, G2311 is different from G2317, which applies to prolonged nursing facility services. Let's review some common home or residency (M) coding traps. First, don't confuse home or residency (M) with nursing facility services. They use different code families. Second, don't assume a patient is new just because they are seeing a different physician. Always check the 3-year history, group practice, and specialty or subspecialty. Third, remember that 99,343 is not a current 2026 home or residency M code. Also, make sure the documentation supports the selected level based on MDM or time. Another common mistake is confusing G2311 with G2317. G2318 is for prolonged home or residency M services, while G2317 is for prolonged nursing facility services. Finally, remember the 2026 G2211 update and verify that all applicable Medicare requirements are met. For the CPC exam, remember, setting right pointing arrow patient status right pointing arrow E, M level right pointing arrow MDM, time right pointing arrow add-on right pointing arrow documentation. Think before you code, and always let the documentation guide your final code selection. Let's work through a CPC scenario. A physician evaluates a new patient in the patient's home. The patient has an acute condition requiring prescription drug management, and the documentation supports moderate complexity MDM. First, identify the setting, the patient's home. Next, identify the patient status, new patient. The documentation supports moderate MDM, so we select the moderate level code from the new patient home or residency M family. The correct answer is CPT 99344. Remember, new patient plus moderate MDM equals 99,344. For CPC questions, always analyze setting, patient status, and MDM or time before selecting the code. Let's work through another CPC scenario. A physician evaluates an established patient in the patient's home for a follow-up visit. The patient's chronic condition is stable, and the documentation supports low-complexity MDM. First, the setting is the patient's home. Next, the patient is established. The documentation supports low MDM, so we select the low-level code from the established home or residency M family. The correct answer is CPT 99348. Remember, established patient plus low MDM equals 99,348. For the CPC exam, identify the setting, patient status, and supported MDM or time level before selecting the final code. Let's test your knowledge with 5 quick CPC questions. Question 1. New patient with moderate MDM? 99,344. Question 2. Established patient with low MDM? 99,348. Question 3. What is G2211? An add-on code. Question 4. Prolonged home or residency, M. G2318. Question 5. Established patient with high MDM? 99,350. Remember the key sequence. New, 41, 42, 44, 45. Established, 47, 48, 49, 50. Great job. Keep practicing. Let's quickly review the key points from 2026 Home and Residency M coding. The Home or Residency M family is 99,341 through 99,350. New patient codes are 99,341, 99,342, 99,344, and 99,345, while established patient codes are 99,347, 99,348, 99,349, and 99,350. Select the appropriate level using MDM or total time, when permitted by the applicable guidelines. For 2026, remember G2211 may be reported as an add-on with qualifying home or residency M services when Medicare requirements are met. For qualifying prolonged services, G2318 is the Medicare Prolonged Home or Residency M add-on, with the applicable time thresholds for 99,345 and 99,350. For the CPC exam, remember the sequence. Setting right pointing arrow patient status right pointing arrow E, M level right pointing arrow MDM or time right pointing arrow add-on right pointing arrow documentation. Know the setting, confirm patient status, select the supported level, and always check the applicable guidelines. Master the concepts and excel in CPC.